now that we've almost ended phase 1 of MCO, are you satisfied with the rate of cases and recoveries as well as number of deaths? Are we achieving the target or is this still a long way?
We are observing very closely in terms of cases that we have and also we compare to other countries. But we do not have the exponential spike yet. But perhaps if we can work together, looking over the last 2 weeks, the cases are still quite stable. And what we fear is that if you have a spike, exponential spike of maybe 900 cases or 1,000 cases, but we do not have that. Every day, perhaps we are getting around 150 to 200 cases. And that is because we are having active case detection. That means we continue to go to the community and identify the high-risk group, targeted approach, and then we test them. So there will be some cases that will be detected as positive. Our detection of positive almost about 8%. So every 100 people that we test, 8% will be positive. So this is why we are doing the active case detection. We detect them, we find them, we test them, and then we isolate and we treat them. So as long as we are within the range of about 150 to 200 cases, that we have not seen an exponential spike of the cases. Unlike other countries, you can see the exponential spike. But nonetheless, we are prepared for the worst. That's the reason why we have the beds ready and we have all the temporary hospital and even our Institute Latihan Kementerian Kesihatan, we also have 19,200 beds ready for that. So we are prepared for the worst, but we hope for the best.
Do you think that this rate of the cases, in order to make it stable, you need an extended MCO or not?
Now, I think we have completed the 2 weeks, right? So another 2 weeks to go. So it's up to us and all of us actually. If all of us comes together as one, and then we practice and embrace that you stay at home, and we, Ministry of Health, we will continue our public health activities, active case detection, and increased testing, finding the targeted group. For example, we identified a few targeted groups, like Jemaah Tabligh, for example, and Tafiz School, and a certain party, or even Rohingyas, and etc. So we have the identification of some of the groups. So we are targeting them, and basically targeting them to test them, so that if we can actually isolate them early, and then we can actually break the chain of COVID-19 transmission in this country. So the next 2 weeks is all up to you and me now. So if we can all have social discipline, if we have a social discipline, I'm sure we can actually flatten the curve. So now they are talking about flatten the curve. That is actually to avoid the exponential spike. So if not, the prediction from JP Morgan and Malaysian Institute of Economic Research is that in the mid-April, we will have the surge. So our challenge is initially, because we fear that the second wave is all imported cases, Malaysian coming back from overseas, whether it's for a tour or students coming back. So that's the group that we are worried that they may bring back the COVID-19. So what we need to do now is focus on the imported cases. Then we have to enhance in terms of home surveillance. We have to make sure that the targeted group, for example, place them in our quarantine center. Although they are negative, we still have to place them for 14 days. Those positive we already identified and we isolate them in our hospitals. We will only know after the first week of April and to see how we perform. If we continue to have, flatten the curve or, there's no exponential increase, then I think we can safely make a decision then. But it's a bit too early for us to make any conclusion now.
But even kalau tak extended, you think it's safe to have Bazaar, Ramadan and everything, because it's just less than 1 month from now?
Yeah, when we look into just like when you go to the market, but what's more important is the social distancing. Penjarakan yang selamat sekurang-kurangnya 1 meter. So if we can practice that and avoid crowded places. So if you want to embrace in terms of Bazaar Ramadan and etc., we need to follow the SOP or the guidelines from the Ministry of Health. that spacing, inter-social distancing must be practiced, and also, hand hygiene and etc. And more importantly is to take all the precautionary measures for us to break the chain of COVID infection.